going to start with cranial nerve 1, olfactory. So if you could close your eyes and then choose one side of your nose to close. Can you identify the smell?
No, really.
Okay, and then switch sides and then keep your eyes closed. What would this smell be? Okay, cranial nerve 1, olfactory is intact. Cranial nerve 2, optic. Okay, so tell me when you see my fingers.
I see it. I see it. I see it.
So cranial nerve 2, optic is intact. We'll test cranial nerves 3, 4, and 6 at the same time, which is oculomotor, trochlear, and abducens. So we'll do the 6 cardinal feels, okay? So can you follow my finger? Okay, and then hold it laterally. So there's no nystagmus noted, and your eye movements are smooth. And then using the Rosenbaum chart, I'm going to cover one eye, just look forward. Okay, so there's no shift in gaze. So cranial nerves 3, 4, and 6 are intact. Cranial nerve 5, trigeminal. Can you clench your jaw, and I'm going to palpate your temporal and your masseter muscles, which are firm and symmetrical. And then we're going to assess touch on your face. So first we'll just do touch. So if you can close your eyes, tell me when you feel a touch.
I feel it. Feel it. Feel it.
Okay, and then now tell me if it feels sharp or dull.
Dull. Sharp. Sharp. Dull.
Okay, cranial nerve 5, trigeminal is intact. We've already done cranial nerve 6. Cranial nerve 7 is spatial. Can you smile? Can you frown? Okay. Cranial nerve 7 is intact. Cranial nerve 8 is auditory. So we're going to use the tuning fork to do the Weber and the Rene test. So for the Weber test, I'm going to strike this tuning fork and put it on top of your head. Let me know when you feel it, and let me know when it stops.
I feel it. I don't.
Okay. So the Weber test is passed, and then for the Rene test, I'm going to strike this tuning fork. I'm going to put it behind your ear. Tell me when you no longer hear it, and then I'm going to move it in front of your ear, and tell me when you no longer hear it.
I hear it. I don't hear it. I hear it. I don't hear it.
Okay.
I hear it.
I'm sorry.
Still hear it? Okay, I don't hear it. I hear it. And I don't hear it.
Okay. So air conduction was twice as long as bone conduction, so the Rene test is passed. And cranial nerve 8, auditory, is intact. Cranial nerves 9 and 10 are glossopharyngeal and vagus, which we'll test at the same time. So we'll test your gag reflex and your ability to swallow. Okay, can you say ah? Okay, the uvula moves up, and then your gag reflex. Okay, gag reflex is intact. And then can you take a drink? Okay, you were able to swallow appropriately, no signs of aspiration. So cranial nerves 9 and 10 are intact. Cranial nerve 11, spino-accessory, so can you push against my hand? And then push against my hand. And then shrug your shoulders against me. Okay, so cranial nerve 11 is intact. And then lastly, cranial nerve 12, hypoglossal. Can you stick out your tongue? And can you move it around? Okay, and then push against my hand. Okay, so muscle strength 5 out of 5. You were able to move your tongue around appropriately, so cranial nerve 12 is intact.